Hello, everyone, and welcome to the Flint Community Webinar, your community resource. I'm so excited with all of the expertise we have to offer you today. We are going to be talking about kidney health, risk, prevention, and resources. And in good fashion, we're going to be describing everything you need to understand about the kidney. We've got some great College of Human Medicine medical students, and they're Flint's own because they're coming to train in Flint next year, and they're a part of our leadership in the Medicine for the Underserved elective run by our very own Dr. Esch. So we've got them, and they're going to be explaining to us a little bit about kidney anatomy and kidney physiology and everything that we're going to need to understand the rest of the conversation that's going to talk a little bit about kidney health, prevention, and what are the resources in the community that we can use to make sure that we are thinking about our kidney health. So we've got Elizabeth Ortiz-Cruz and we've got George Abouita. These are our wonderful medical students. We've got Dr. Nicole Jones from the registry. We've got Mary Wozniak, program manager of the National Kidney Foundation in Michigan. And we've got Diana Haggerty, who's going to help us think about the statistics in Flint. And then we've got our wonderful Dr. Nursi to tell us a little bit about what does the community want to know about kidney health. So we've got a wonderful lineup for you today. We've got some McLaren physicians, some Pearly physicians, lots of good representation from the community to help think about all the things we need to understand today. So I will hand it off to our wonderful medical students who are going to help us think about what is the kidney, why do we need to think about it, and why is it important?
Okay, thank you for the introduction. We're so happy to be here. So we're going to start off by talking about, kidney basics. And if you have any questions, just let us know in the chat. We'd love to hear from you. So let me start by talking about where the kidneys are found. So most people will have two kidneys, so one on your right side and one on your left side. And if you take your hand and close it into a fist, that's like roughly about the size of each kidney. And so like looking at the picture here, they're found towards your back. So if you sort of like feel for your last rib in your back and then slide your hand closer to your spine, that's kind of where your kidneys are, and the ribs sort of form like protection for your kidneys. So it protects it from like physical trauma. Yeah, and so the amazing thing is that like one healthy kidney can do the work of two kidneys. So for someone that has like renal failure from like chronic kidney disease, then like getting like a matched donation can really like improve the quality of life and the lifespan for that person. So. And now talking about like inside each kidney. So each kidney has millions of nephrons and they sort of work like coffee filters in that they clean your blood. So you have your heart that's going to be pumping blood to like all of the organs in your body. And eventually that blood's going to reach the kidneys. And so when they enter the kidneys, this is like a picture if we like took a kidney and sliced it down. Inside your kidney, you have millions of these nephrons, and the blood's going to get cleaned by the nephrons, and then it's either going to return to your body to be used for other purposes, or the nephrons are going to convert that waste product into urine, and then you would just urinate it out. So your kidney is going to do this like all day, every day. And if you like look at this like gallon of milk, you like multiply that by 50, that's how much blood your kidney is cleaning every day. So they do a lot for us. And then not just that, like they have so many other like functions in the body. So they would help remove extra fluid through that urine. So that's going to help control our blood pressure. And then they also help with creating red blood cells. And that's important for getting oxygen to all of our organs in our body and helping us have energy. And they also help with our body producing vitamin D and sort of using that to create strong and healthy bones and teeth. And they also work as like chemists, so they help maintain the acid-base balance in our bodies, which is important. All of these things for keeping us healthy. So they do a lot of things. And so kind of what happens when the kidneys are not working well, you can get symptoms such as like poor appetite and headache. And that would be sort of from like the waste and fluid building up in your body. because you're not able to create that urine. And your blood pressure can also rise because you're retaining a lot more volume than you would normally have in a healthy kidney. Your bones can start to sort of weaken because we don't have that vitamin D that we need from the kidney. And also you can present with like signs of early fatigue, insomnia, and that's because we're not producing like as many red blood cells, and our body needs that sort of for us to have energy. Um, so these are all the symptoms that we might have with like kidney failure that's like sort of worsening, and eventually this can progress to like chronic kidney disease. And so I'll pass this on to my colleague George, who's going to talk more about kidney health.
Thank you so much. So kidney health. So as Elizabeth said, when your kidneys start giving up, you eventually have something called chronic kidney disease, which I've abbreviated as CKD. So you're probably asking yourself who's at risk, right? Pretty much a lot of people can be at risk. It's more common in adults and rather than kids, and I'll explain why. So the biggest thing behind this is the two most common causes of chronic kidney disease: high blood pressure and diabetes. So these damage the kidney filters over time, and usually this increases with a lot of different factors. Poor diet is a huge one. Sugary drinks is a very big one, and I'll get into a lot of these later. Lack of exercise and aging. Aging is a very, very important factor of chronic kidney disease. As we age, our kidneys, the amount of load that they can handle tend to decline. So that's why these early habits matter, which I'm going to talk to you later on. There's obviously a lot of other causes, like inherited causes or like injuries. So in the US, CDC estimates that there's about 1 in 7 adults that have chronic kidney disease. And I just want you to see this loop, like when you have high blood pressure, it leads to chronic kidney disease, and chronic kidney disease just goes right back to high blood pressure. So it's just an ongoing cycle that you're dealing with. So 3 ways to protect your kidneys. They do a lot of work. We really, really want to protect them. So I broke this down into exercise, drinking water, and eating healthier. So you're probably thinking to yourself, obviously these are basic things, but I just want you to think of your kidneys as a very, very important organ, almost like your heart and your brain. So we really want to control blood pressure and control our weight, and exercise helps with that a lot. And it doesn't need to be anything crazy. There's simple things that we can do, such as walking, cleaning, gardening. 60 minutes a day is usually a good place to be, but obviously not everybody can get that. So if you can do 10 minutes a day or 15 minutes a day, that's a very, very good start. And I just want to emphasize that the little things do matter, choosing to take the stairs or just in general, like biking or swimming or just like doing little things all throughout the day that can help you. Drinking water and eating healthier, I can't stress this enough. What you put in your body depends on how your body reacts to it and just leads to an overall healthy body. So choosing whole foods, drinking a lot of water, and limiting soda, juice, and sugary drinks, because these can lead to diabetes and hypertension. They have a lot of sugar in it, especially juice. Like people don't realize that orange juice and apple juice have a lot of sugar in it. Limit the fast food. The salt leads to hypertension, and just a big no-no for your kidneys. So those very small habits a day will make a big difference. Next slide, please. So if your kidneys fails, there's pretty much 2 routes we can go. Obviously, there's medications that help control blood pressure and stuff like that in the meantime, but if your kidney fails, you can either get dialysis or a kidney transplant. So dialysis is essentially what it is just a machine that does what the kidney does for you. So it just filters your blood. And I've added a picture here where somebody's hooked up to a hemodialysis machine. There's different dialysis methods that you can do. And basically this machine just filters out the blood and does what the kidney is supposed to do. And usually patients will go to like appointments 2 days a week or 3 days a week. And also a kidney kidney transplant, sorry. As Elizabeth mentioned that early on, 1 kidney is enough. It can do the work of both kidneys. So if somebody can just transplant that 1 kidney and live with that, they're good out. But obviously, early prevention is the best protection. Next slide. So just to wrap things up, please, please, please take care of your kidneys. Your kidneys protect you, so protect them back. Just kind of reminding you of things. So exercise daily, regularly, drink more water, eating healthier foods, those whole foods, avoiding the salt, avoiding the sugar as much as you can. And one thing I want to emphasize here is balance is really important. The goal isn't to cut everything out, but the goal is to be more mindful of your everyday interactions with food or just specific exercise of, okay, I can probably take the stairs instead of the elevator today. And all these things funnel into controlling your blood pressure and diabetes. Thank you.
That was wonderful. I want to answer the question in the chat. There was a question about that exercise that you recommended, the 60 minutes of exercise, in addition to all of the other great recommendations you had. Does that have to be done all at once?
Not necessarily. Like I said before, I mean, your body doesn't really work as a clock. Like it doesn't, okay, today is like, we did this much minutes of exercise. Tomorrow we did this much. Like if I did 120 minutes of exercise yesterday and none today, it's not that big of a difference. So if you do 10 minutes in the morning and 10 minutes at night, and like throughout the day, you're making these mindful decisions of taking the stairs, like that adds up. So you don't have to do it once a day, no.
Yeah, that's one of the things I talk to my patients about too, right? This idea that the thing that is most effective, the thing that you can do most regularly and that you can do with some consistency is the thing that is the most helpful. So the other valuable point to make is that if you break that 60 minutes up into 20 minutes, that means that each of those 20-minute intervals, you're sort of experiencing that impact of that exercise and your body is sort of experiencing it. So that is one of the ways in which it can be valuable to you, how often you're engaging in exercise and breaking it up. So I appreciate you so much for talking about that. I'm just looking at the questions in the chat and it says, what seems so simple to prevent kidney disease is so challenging for some people because they don't have access to walking in their neighborhoods, foods, clean water, et cetera. And I appreciate, Nurse T, you so much for bringing that point up, because I do think it is meeting yourself where you are. If you are living in an apartment complex where you've got stairs, if you've got a place at work where you can walk, I completely agree. It's not always about the sort of the modality. It's sort of making it work with what resources you have. So I think that's an excellent question and point. There's one more question in the chat while I have you experts. What blood test should we be thinking about paying attention to if we're trying to monitor kidney function?
So kidney function, yeah. So it's a great question. So kidney function is great when you're looking at GFR, which is like the rate that your kidneys are actually filtering things. There's other things that we can measure, like BUN and creatinine. These are very, very good labs. It's basically telling what the kidneys are doing in real time. The reason I bring up GFR is because I mentioned aging, and that's what usually tends to decline as you get older. And there's a very clear graph that shows when you age exponentially, you have a decrease in GFR. So those are three big things to look at when you're trying to look at blood work. I don't know if Elizabeth has more things to add.
Yeah, I would also add, you had mentioned like diabetes is like such a big risk factor, especially like in our country, we have like so much like processed food. So like following up with like your healthcare providers to like make sure your blood sugar is like not that high, because that can also put you at risk for chronic kidney disease and like your blood pressure too. So like trying to lower that hypertension.
I've got a friend joining me. He wants to talk about kidney disease too. No, I think those are wonderful examples, right? So I heard your GFR, which is your glomerular filtration rate, which is sort of the rate at which your kidney is sort of working and filtering. I heard BUN and creatinine, and I also heard that you want to monitor your chronic diseases, right? So you want to make sure that diabetes or any other chronic diseases that you have are well controlled. And then you always, my own blood pressure cuff is back here, right? Like you always want to have your blood pressure cuff and be monitoring your blood pressure to make sure that it's within range and appropriate for you. So those are things that people should be talking with their doctors about. All right, that sounds wonderful. I thank you both, because the amount of effort, the amount of time you put putting this together to present wonderful presentation, wonderful information about kidney function, anatomy, physiology, helping us understand the things that we should be considering. So really, really, really appreciate you and you bringing your expertise to the rest of the Flint community today. Thank you so much.
It was an honor. Thank you for having us.
Awesome. All right, so we're going to talk about data. We're going to talk we talked a little bit about kidneys, where they are, how they function, and now we're going to talk about kidney data in Flint. And we've got wonderful expertise for that. So thank you both, Dr. Diana Haggerty and Dr. Nicole Jones. I'm going to give it to you.
Great. Diana, I think is going to share. Okay. Hi, I'm Nicole Jones. If you want to go to the next slide, Diana. We want to talk a little bit about some of the data we're seeing around kidney health in adults in the Flint area. And one of the sources of data that we have is the Flint Registry. So just wanted to share a little bit more about the Flint Registry. The Flint Registry is a CDC-funded project that was launched after the water crisis. Our goals are to connect people to services and programs to promote health and wellness and help us understand how the Flint water crisis has affected the Flint community. So people who are in the Flint Registry, in order to be a member, have to meet certain eligibility criteria. It's people who were exposed to lead-contaminated water in the city of Flint because they lived, worked, went to school or daycare during the time that we were on water, locally treated water, during the time of the water switch. They had to be exposed at an address that was serviced by the Flint water system. And this can include children who may have been exposed during pregnancy. So our motto at the Flint Registry is really making sure that people are getting counted, they're getting connected, and they're getting supported. And we focus on two key questions. Number one is, how are people doing? And then the second question is, what support do they need? And we know the work of the Flint Registry is long-term work. We know that based on research that being exposed to something like an environmental crisis can have long-term impact on people's health. And we also know that exposure to lead can have a long-term impact on individuals' health over the course of their lifetime. So the primary source of data that we use to answer those two questions about how people are doing and what support do they need is by conducting surveys. And we launched our first round of surveys in 2019. Those surveys ask about service needs, about health, both physical health and mental health, and about child development. So there are over 22,000 people who have joined the Flint Registry and completed what we call the enrollment survey, that first survey. And we've made over 35,000 referrals to services in the areas of child development, health, lead elimination, and nutrition. So we have both adults and children in the Flint Registry, but we want to share some of the data that we have on adult kidney health today. So our last follow-up survey was completed in 2025. And Diana, who's our Director of Research and Evaluation, is going to tell you more about what we're seeing relative to adult kidney health.
All right. Well, I'm excited to share a little bit with you about why we decided to undertake this work specifically. In 2024, we put out a publication in BMJ Public Health that identified the prevalence of several chronic diseases in Flint, Michigan were higher than what we were seeing in Michigan overall. So we can't really attribute the cause of that difference, but we see it as a red flag. There's something going on here that needs attention paid to it. And one of those diseases was kidney disease. In fact, it raised the eyebrows of a few people who accessed it. I know State of Michigan started working with some of their data a little bit more closely as well. But basically what we were seeing is among people who are self-reporting a diagnosis of kidney disease, in Flint Registry women, we were seeing about 7.3% were reporting that they were ever diagnosed with kidney disease compared to 3.7% of Michigan women. And in men, it was closer to 8% compared to 3%. So this is a pretty large, this I would consider as a very big red flag for the community. We'd also heard from community conversations in our, both in our monthly community meetings and then from some of our Flint Registry specific community partners, that there's a lot of concern about kidney disease among our community members and in unexpected populations. There's some talk about young folks. So we wanted to dig a little bit deeper with data that we have collected more recently. So when we look more closely at this prevalence, I have the blue bars are showing approximately what you would have seen when I was reporting, comparing to state of Michigan, but now we're comparing Flint Registry at the enrollment survey to our 2025 follow-up. So for all of our enrollees, so that's anyone who's exposed to the water either through live, work, play, school, very similar frequencies, right? Between baseline or between enrollment and our wave follow-up, about 7.5%. For our city of Flint resident participants, so these are people who reported that they were living in the city of Flint at the time of the water crisis, of the water switch. 8% were reporting a diagnosis in our enrollment survey. At our follow-up survey, 7.3% reported that they'd ever received a diagnosis. We've had it could be a slightly different population from our enrollment survey to our wave survey. It could also be that we've had people move out of the survey through various mechanisms. So we're looking at that going, okay, that's prevalence. It's still pretty similar and it's still much higher than we would expect. When we look at gender prevalence, they're very similar, except with the men who reported at our 2025 survey, that had fallen back to 7.3%, so closer to what we're seeing in women. So again, that could be folks who are leaving the survey. It could be that we have a healthier sample of men as well. That's work we need to dive into. And then what I think is really interesting is that we do have, we can look at folks under the age of 45. Usually this is an age group we're not super worried about kidney disease in. We have about 3.5% prevalence at baseline, and that's a slight uptick when we look at the WAVE survey. You can see our WAVE survey for our older groups, the prevalence declines a little bit. So again, very potentially these are going to be healthier people who are reporting here, or people who've kind of survived to the point to be able to report in 2025. But it is interesting to see that this increase is, and there's a difference in prevalence, a small difference, but for our young folks. So something to dig into a little bit. And then finally, what I wanted to understand is how many people were reporting new cases from our enrollment survey to our 2025 survey. So this would be people who didn't have a self-diagnosed report of kidney disease at our enrollment survey, and then 1 to 5 years later reported that they did have a kidney disease diagnosis. So for a full cohort, that 7.6% is supposed to be 4.6%. I'm going to apologize. I'll point out where that is in a moment. I should have caught my slides. For the full cohort, it's about 4% of what we call incident kidney disease, 4.6% incident kidney disease, not 7.6. I'll correct that in case anyone wants these slides. 4.6% in our city of Flint. Among women, that incidence is 4.1%. In our men, it's 3.7%. Under 45, 2.3% of our under 45 respondents in the WAVE 2025 survey reported new kidney disease diagnoses. So that's, again, that's a little bit of an alert that maybe we need to be looking more closely at that. And then 4.4% for our 45 to 64 years old, and then 65 and older was 6.3% incidence. So those are the data we have. You're welcome to contact me. Like I said, if someone wants to see these slides, use these slides, please reach out, and you can find the Flint Registry at theflintregistry.org. And we do have more data from our surveys on the website. So if you're a data nerd like me, you can look at what's going on in the registry.
We're all data nerds like you. That's why we're here. All right. Thank you so much. We've got a couple of questions, and I'm just checking them from the Q&A. One of the questions was, does exposure to lead have an impact on kidney health? My husband was exposed and has, and I think it's now has stage 4 kidney disease. And this is a discussion. I certainly think our exposures are things that we need to consider relative to our potential to develop disease. And this is a conversation we absolutely have to be having with our providers, like what sort of exposures are we at risk for, whether it's water, whether it's where we work, whether it's where we play, whether it's our whether it is our exposures. And so those are definitely things that potentially are things that we need to think about. Is there a direct link? I don't have a specific answer to that, but it's definitely something that we should be having conversations with our providers.
So
Yeah. Oh, I was going to say, we use the reference,
Yes.
I'll let Diana speak to. We use the Agency for Toxic Disease and Substance Registry, ATSDR is sort of our
Yep.
is our source of research on lead and health, and what has sort of a strong association, a moderate association, or weak association between lead and health. And many of the questions that we're asking in the Flint Registry, we specifically picked because we were concerned and we wanted to monitor those things in the community. And then I'll let Diana talk a little bit more about the research around kidney health. Yeah.
So I want to highlight that lead was one of the exposures, and it can have what's called a nephrotoxic effect, or it can impact your kidneys.
Yeah.
There's some good evidence for that. And again, what Nicole just referenced is it's kind of my Bible of what can hurt you, I guess is a nice way to put it.
Yeah.
But there's other exposures. I'm thinking like the trihalomethanes, and there was some, I think Heatherlyn, you might be able to better speak to this. There was a state of Michigan report recently that looked at another one of the potential exposures and whether that changed kidney disease prevalence in Flint. And so it's hard to pinpoint. I mean, unfortunately, one of the tough things about lead is it has a really short half-life. And so I'm really sorry to hear about your husband's diagnosis. That's a really hard diagnosis to get, and kidney disease is tough. It's a really tough disease. But also it's not like we can go back and look at the exact lead exposure through blood lead at the time, unless somehow you archive blood, but that's unless you're a data nerd like me, you're not thinking about archiving your anyway. No, we can't go back and like examine blood lead levels to understand historical exposure. And then if we looked at something more like a bone lead level, that would be a really long trajectory of time. So it wouldn't pinpoint that Flint water switch exposure. And but it wouldn't on a personal level surprise me if it's related. I guess is a good way to put it. But we can't necessarily say exactly.
But I think the question is it gets at that idea of, and I appreciate so much the question, and I want to echo Dr. Haggerty's thoughts about that's a really, really hard thing to have to navigate, right? And have to figure out. And hopefully the goal of the webinar like this is to aid with some understanding, but also some resources so that people can have the resources they need to navigate challenging circumstances like this. It does bring to me the idea that it's a good question because it helps us understand what are the types of things we might need to consider as we're considering diagnosis, a diagnosis that might pop up for us in the kidney. So certainly the question is a really, really valuable one of trying to understand, could it be an exposure that I had through water? Could it be an exposure that I had through my work? Could it be an exposure that I had through this? Could it be this chronic condition? And I do hope that, what people get out of this webinar are starting to sort of understand even what questions they should be asking and what are the types of things that might cause exposures. And I'm hopeful that some of this will help you think about it. So very much thank you to the person who asked that question, because that's exactly what we're trying to help people understand and start thinking about today. All right. We have got Mary Wozniak from the National Kidney Foundation, who is like throwing in some really good information in the chat. Super appreciate you, because you were thinking about labs in real time and you came in with the urine microalbumin. So shout out to you, and please take it away with all the expertise you have. Appreciate you.
Awesome. Really glad to be here and talk with you all about some of the, just education resources and programs that we have available for community members that you may not be aware of through the National Kidney Foundation. I'm sorry, trying to share this. Okay. So I'm a program.
There you go. Yep.
manager with the Kidney Foundation. We've been around for 70 years. Our mission is really around both preventing kidney disease and improving the lives of people who are living with it. So we really provide essential programs, services, and resources to folks who need them. I do want to throw in, I love that this talk always has some data component to it. I want to throw in just another data source that is available if you're interested in accessing it. The information is below. But this was a analysis that we conducted back in 2022 of Medicaid claims to get an understanding of Medicaid in Michigan. So you do see the varying degrees of diagnosed CKD based on different demographic groups. This is broken down by race, but we also have it broken down by sex and age cohorts. Certainly non-Hispanic, Black, and Native Hawaiian Pacific Islander are jumping out as having the highest risk in Michigan. And then also to give you a sense of geographically where kidney disease is having more impact, there are different interactive data maps. So this map really focuses on the CKD screening rates, and those counties with the darker orange have the lower screening rates. So more room to improve in kind of that middle of the mitten. Certainly Genesee County is included there, thumb area, and southeast and then southwest Michigan. And then also there's a cost tab that kind of breaks down based on different stages of chronic kidney disease, the cost of care for those individuals. But I'm not going to spend too much time on that unless someone has a specific question. I really want to focus on some of the educational resources. This is a campaign that we have been running for about 3 years as a digital campaign to drive people to understand the risk of kidney disease because we know it's so underdetected. Unfortunately, up to 90% of people with kidney disease are not aware that they have it because at those earlier stages, there's really not a lot of signs and symptoms until your kidneys get pretty bad, pretty unable to filter. So this campaign has been designed for, social media text messages. There's all sorts of different examples. If this is something you'd like to spread awareness about, particularly as March is Kidney Month, you're welcome to access this toolkit and go in there and share out any of this messaging. And it has been designed for different populations within Michigan. So African American, Hispanic, Latino, there are ads in Spanish and in Arabic. And then we also worked with some of the tribal communities in Michigan to develop some specific ads for that population as well. The link below has a lot of info. It's kind of what am I trying to say? Just an easy place to find a lot of different resources for medical providers and for patients who want to learn more about their kidney health. These are a couple of the popular handouts. In particular, I want to point out the one on the right. Just has some nice graphics, very simple language to explain, the GFR levels, what urine albumin is, and then focusing on health as well to understand someone's overall kidney health. We often get questions on nutrition, what can I eat, what can't I eat? So there is a whole page on our website about CKD nutrition. I really like this handout that says, what are the kidney-friendly foods? And then a lot of tips for, reducing sodium intake and all those things that Elizabeth, you touched on. And then also other ways of managing chronic kidney disease. This is a new document that was created really with the intent to have a conversation between a healthcare provider or a clinical staff with their patients to help the patients set some specific healthy living goals and really have it be driven by what the patient wants to focus on. So being able to choose your first goal, create a very smart action plan, something specific and time bound. Encouraging them to reward themselves and also check their confidence level. This is kind of goes along with motivational interviewing concept is, making sure that they are confident to move forward with that particular change in their lifestyles. And then also some warning signs, the stoplight colors of when to seek emergency care or to call your doctor. Just wanted to highlight, I'm sure you all know the importance of health literacy and really being able to speak in terms that the patients are going to understand. Certainly listening to the way that they explain things themselves and getting that feedback through the teach back method is great. But these are some words that may be a little tricky, like nephrologist, nephropathy. Not everyone is familiar with those terms. So really just, explaining that means that your kidneys aren't working, they're not cleaning the blood like they're supposed to. So just some examples. Albuminuria is one we say a lot, but really it just means that protein is leaking into the urine and that there might be some damage in your kidney. These are some of the free evidence-based programs that the National Kidney Foundation can offer. These are available both in person. In the Flint area, I'm afraid I don't think we have in-person programming at the moment. There are also almost all of these offer a virtual option as well. But we focus from everything from, really preventing those conditions that can lead to kidney disease, so diabetes, really managing high blood pressure through the high blood pressure control program, and then also providing education information for people living with kidney disease. And really the PATH program is designed to enhance people's ability and confidence to manage their chronic conditions. And it takes place in a group setting. So there's that group aspect of kind of learning from one another, setting those smart, actionable goals, and really gaining some skills and information about their particular conditions. And then finally, we have physical activity programs, and then a falls prevention program. So if you are interested, I encourage you to check out the website, and please reach out if you'd like any more information or on how to connect yourself or your patients. We have a variety of services through our patient services department that really center on people living with kidney disease. Everything from education and information. We have support groups that meet twice a month on Zoom. That are very popular. We also offer kidney screenings out in the community. So if this is something that, there's a big community event coming up, please reach out. We would love to be able to participate and bring information and also reach people who especially maybe aren't already accessing a healthcare organization to learn about their kidney health. I also want to point out we have an emergency fund for people living with kidney disease. So we have supported people in being able to cover their utility bills if there's an emergent situation, or afford a copay for medication, that kind of thing. Transportation and healthy food certainly come up as probably the top two barriers that people are experiencing. And we also have resource navigators on staff who speak Spanish and English, and they can connect people to further community resources in their area. This is a tool called Finding Your Way. It's really designed as kind of a roadmap to guide whether you're a social worker, community health worker, even, a community member who wants to understand more about the social systems that exist in Michigan. We have these books are for the state of Michigan, but also one specific to Genesee County, which is featured here, and really helps break down those application processes for various programs out there, to include, everything from Medicaid to transportation assistance to prescription assistance programs, things like that, the basic guidelines for receiving help, and tips on finding resources for basic needs. So encourage you to check this out if you think that could be helpful. We are also in the process of creating one of these more specific to chronic kidney disease. Hope to be launching that in a couple of months. I also just wanted to put this out there in case you or your patients, your members are interested in participating. We have webinars going on about, again, nutrition is such a hot topic. What to eat, how to save money when you're shopping for healthy foods. So these programs are available by Zoom, and you will have to check the times really vary by each day. So you'd have to check the website if you want to see exactly what times they're being offered. But this is a great place to learn about, just saving money, being able to understand the nutrition facts, especially as it relates to someone living with kidney disease who might have to keep an eye on phosphorus and potassium and things like that. Okay. I also just wanted to share, we'll share these slides out later, I think, but just some links to learn more about like the professional guidelines around screening and management of kidney disease. That's kind of the first 4 items there, and then additional resources for providers. One I didn't go into much depth, but I really love what the Michigan Center for Rural Health has created. It's a toolkit all about how to implement CKD screening in a rural health. Honestly, it can be used for urban health too. But just a lot of great tools, sample policies, sample clinical decision supports, and education in there as well. Okay, had a lot to cover, but would love to hear if there are any questions or
Yes.
any particular needs, that you're hearing in the community, any things that would help you in your practice to talk to your patients about kidney
This
disease.
is all phenomenal. Like, these are such wonderful resources. And I want to see if Nurse T, I saw Nurse T putting some comments in the chat about resources that could be helpful, because she was mentioning, I love this. In the community, I sometimes refer to the kidney as the king and the heart as the queen.
I
Nurse
love
T, do you
that.
want to come forward and say, like, what are some of the questions in the community you get about kidney disease and how people can manage their kidney disease? And I don't know if I saw her. I don't know if we lost Nurse T.
Hi, everybody. So I do have a couple of questions. One of the common concerns that I often get is why is the Black and Brown community, they want to know more, why are they more affected? And a question they have is, how do I prevent it from happening to me if it happened to my mom and my dad? So I get those questions a lot. It's always like, why is it always us?
That's a great point. Yeah, absolutely. And I think it's certainly probably a multifaceted answer. There is, family history, of course, is a huge risk factor. And there are certain genetic alleles, even like the APOL1 gene, that may contribute to a higher risk. But there's also, of course, there's other factors like social determinants of health, and maybe, not having access to those healthy foods. Maybe you're eating a high sodium diet, and that's contributing to blood pressure, which is then leading to more kidney disease. So unfortunately, I think it is multifaceted in that way. But I think the advice that the medical students gave earlier on, just about like healthy lifestyles, is great. Another thing I would consider, though, if they have a family member diagnosed with kidney disease, is, has that person been tested at all, for the genetic components? And is there anything in there? At this time, I don't believe there's any particularly targeted treatments based on that, but I know there are some things in the works in terms of clinical trials and whatnot. So it would be helpful information, I think, to know if that is a risk, and then to really keep an eye on things like reducing that sodium intake, and having their labs checked regularly as well, to keep an eye on it, right? Because there's so much that can be done even in those early stages of kidney disease to slow that progression and hopefully avoid dialysis down the road.
Yeah. And a lot
I wanted to really quick, I was going to explain alleles. So just so we are all, I would think of alleles as genetic data almost, right? So a little place, there are some of these genetic data that are specific to kidney disease, and that can be passed down. So those are the things that we think about. Sorry, Nurse T. Go ahead.
no, it's fine. Another thing is, like, even being in the community, we do a lot of health literacy education and prevention. And then what sometimes the community want to know is, what is it that I absolutely need to know? When do I really need to know that my body is in trouble? A lot of times it's not because they don't want to prioritize their health, but they just may not have the time, the access, or the resources. And even though we promote early prevention, identifying your signs and symptoms and risk factors so that you can know how to respond. So what are some symptoms that you would absolutely tell them to not ignore?
I would go back to uncontrolled hypertension and uncontrolled diabetes, because those are the ones that are going to drive further changes, including heart problems too. I mean, heart disease is the #1 killer in the United States, and those are huge factors that drive that too. That would be my recommendation, to focus on those.
Yeah. And those can present with things like headache, changes in urinary frequency, sudden onset of fatigue that's different from normal. You're waking up to pee all night is another thing I would want people thinking about, all of those things. And great, we brought Dr. Ash back because we've talked about big people for a while. We've talked about all the adults in the room, but and I know the answer to this, but I'm going to phrase it this way on purpose. But do kids struggle with kidney disease? Are there spaces in which we need to think about the little people in kidney disease? And what do we do about kiddos?
Yeah, absolutely. Thanks for having me on. Kid kidney disease is very different than adult kidney disease on so many different levels. Actually, oftentimes we see things like high blood pressure, and we immediately think of the kidney before we think of the heart. We might have a kiddo who has, generally speaking, when we have kids with kidney disease, it's because of something anatomical, meaning they were born maybe with their kidneys having multiple cysts, or maybe they were born with the structure of their kidneys not the same as everyone else. We have something called ureterovesicular reflux, which is an issue where essentially like reflux you get in your esophagus, where you feel like the acid coming up. The same thing can happen in your urine, where it goes from your bladder upwards as opposed to downwards. So we think about this in a completely different way, but we do see kids who end up with kidney disease and kidney failure. They will be followed by kidney doctors or nephrologists. So it's also a different world in the sense that in pediatrics, more often than not, if we see a kiddo who has abnormal kidney function, so going back to that BUN, the creatinine, we tend less to look at the GFR necessarily, initially at least, but once we refer out to a kidney specialist, if they are having signs of kidney malfunction, then they start looking at the GFR to help them. We actually see the kidney impacted by a lot of things in general, so not even talking about chronic kidney disease, but what we see more often than not, or myself especially as someone who works in the hospital, is something called acute kidney injury. And this is something we actually see quite often in kids, and the most often cause, or the biggest cause, is dehydration. So babies and kids can get dehydrated very easily, and that can actually really hit their kidneys. They end up with temporary kidney issues, more often than not temporary. We give them some hydration and their kidney function comes right back to normal. And then the only last thing, because I don't want to take up too much time, is our teeny tiny babies, so those under the age of 6 months, have kidneys that are still developing. So their kidneys don't filter waste quite the same as my kidney and your kidney, or even older kids. And so we just have to be extra, extra careful about what goes in their bodies. I get a lot of parents asking me why kids can't have water. And this is actually the primary reason why. So the way their kidneys work is different than ours. And so giving them free water, or just like a cup of water or water in a bottle, can actually really impact their electrolytes in their body. So this is why we don't give kids water until they're at least 6 months of age, and we're very kind of strict about that. And we also have to make sure we mix formula appropriately, and no ibuprofen, no Motrin before the age of 6 months, because their kidneys just can't handle it.
I love all of these points. I especially love the idea of be very, very thoughtful about the formula that you're giving. We should not be using more water, even on those really, really hot days. Formula is exactly what they should be getting. It's sort of perfect for the electrolytes and what kids need. You mentioned GFR a few times, and I know we've defined it, but I want to bring us back so that everyone remembers that a GFR is sort of a measure of the amount of filtering your kidneys can do in a specific amount of time. And so in that way, it gives us a little bit of a measure of if our kidneys are functioning appropriately. If the kidneys are filtering at the rate that they should, then we know if the kidneys are working how they should be. That's a test that we use really, really frequently. There was another question about GFR. I just want to make sure I get to all the questions that says, anyone want to answer that?
So I know that it can slow. I don't know a whole bunch about adults, but I do know that exercise, good lifestyle, exercise can slow the progress of chronic kidney disease. I'm not quite sure about studies in terms of improving, but it can definitely slow.
So definitely when we look at GFR, whether it can be improved or not sort of depends on why it was initially lower to begin with. And so it depends on our ability to fix the problem. So if our GFR was down because of one of the things Dr. Esch just described, our GFR can decline because of something called acute kidney injury. So for a short period of time, we've had some sort of insult or something, dehydration, something that has impacted the kidneys. Oftentimes, if we can reverse that, if we can fix the dehydration, we can see our GFR levels return to normal. So you can think about it as anything else where you're working on something and you get a little bogged down or tired and you can't work at the level that you used to. But then that virus, whatever you were dealing with, kind of goes away. And then you can kind of get back to where you used to. That is not always the case, right? That's where we talk about chronic kidney disease. And there is a loss of kidney function that can happen and be permanent. But certainly, as Dr. Esch and many others have alluded to, there are things that we can do to stop the progression or slow the progression of kidney disease and slow that down so that their kidney function isn't declining as quickly. So these are all really, really wonderful questions, and I appreciate it. We've got a bunch of wonderful expertise, and so I'm going to keep bringing the questions back up. Okay. It says, how often should we have our blood tested? How often should we get kidney testing? I don't know if anyone has a suggestion for that. And I usually think of it as it depends on sort of what your source of kidney disease is. If you have a chronic condition like hypertension or diabetes that isn't well controlled, then we're often monitoring those things like every 3 months and we're checking in, especially for things like diabetes. If you have something that's more well controlled, it's often every 6 months that we'll be checking in on those labs. But I'm certainly happy if others have. Go ahead.
So in kids, we don't regularly get this test, as you can
Right.
imagine. Kids are mostly healthy. We oftentimes, if we have a kid who comes into the hospital dehydrated, we have any electrolyte concerns, we get them tested. And then I wanted to make a quick comment. This is a little bit just something from the chat. Someone had mentioned that checking the urine for protein is a really good way of keeping track of this stuff. I will mention that if you happen to see protein pop up in the urine of a child, say your kiddo's at the hospital and you notice that they have protein in their urine, don't worry right off the bat. Talk to the doctor. Kids have a lot of funky stuff pop up in their urine when they're sick too. So illness actually, you can end up with a little bit of blood in your urine, sometimes protein, ketones. And so this can be actually pretty common for kiddos. But in kids, we don't regularly check kidney function unless we have a reason to. So again, if you see blood in your urine, high blood pressure, dehydration, anything that might indicate that something's going on with the kidney.
Thank you so much. Okay, Mary, I want to ask you, what is the biggest challenge that you see in reaching out to community and making sure that community has the education and the resources they need? And what could we all be doing to make sure we're educating the community?
I think it depends on the individual, but certainly we see, just a lack of understanding about what the kidneys even are and what they do. So I love that Elizabeth really, focused on that initially, and then really driving home that message of what puts you at risk. If you have diabetes or high blood pressure, you should be getting tested. You should be talking to your doctor about this, the importance of talking with your family members too, to understand your family history, I think are great starting points.
That is awesome. Thank you. Doc G, I wanted to go to you because I see you put some things in the chat. What are the most important points that you want the community to understand or think about when it comes to kidney disease?
Just everything that was spoken of is really good. Like within your means, like, the water, we know, like in Flint, we have a water issue. So, the bottled water, but then you also worry about the microplastics. So it's a lot of things, moving parts, but get the best fresh fruits and exercise. And also when you go to your doctor, having that relationship, that two-way conversation, that health literacy, knowing about, like, are my kidneys being checked? Am I at risk? Because, like you spoke of, like family history. And then a lot in the community, people say, well, I don't want to take my blood pressure medication because it can lead to kidney damage. So having that conversation about what's the best medication for you and those different things. And then also, like with me, I'm like in psych. So when you go get psychiatric medication, you'll be checked. Your kidneys are big on a lot of those medications. So you'll check before you start, at least 3 to 6 months, and, annually within your primary care doctor.
We didn't talk a lot about this, and it's a really good point. A lot of there are medications that control your blood pressure that also have an impact on your kidneys. And I want to underscore that impact is typically temporary, as your kidneys are getting used to starting to manage the blood flow that now has to go through the kidneys. So if you can imagine that you decrease your blood pressure and you open your vessels up so that more blood can go through your blood vessels, that means more blood is going through the kidneys for it to filter. And temporarily your kidneys are like, oh, we got to catch up. We got to run a little bit faster. And they're kind of figuring that out. So it is absolutely true that for some medications, you can have a temporary reduction in your GFR. You can have an impact on your GFR. I definitely want you having these conversations with your providers, though. What medications am I taking? Could they be impacting my kidneys? Because there are medications like NSAIDs, or NSAIDs are things like ibuprofen, right, Motrin, those sorts of things that can impact your kidney and that we need to be thinking about. And it doesn't necessarily mean stop them tomorrow, but it does mean think about how you're taking them and have conversations about how you take those medications and what medications are best for you. So Dr. G, thank you so much for that important point. Dr. Esch, I saw you unmute for a second. Go ahead.
I was just going to say, I think this also just, we've said this in the past few, but writing down family history, talking to your family. I have a notes app, like on my notes app, I have a running document of like my family history, my husband's family history, just because we don't always talk about, who had what. So maybe this is a good like kickstart, go home, ask your family, any kidney disease run in our family, high blood pressure, anything to do with that, I think can be really helpful. And even like any congenital kidney disease. So that means like, was anyone ever born with anything with their kidneys could be really important for us to know. But conversations with your doctor about what medications am I on, how can they affect my body are really important too.
And I love that. And if there are other health conditions that you find out that are in your family history you want us to talk about, you just let us know so we can find our other experts and bring them back to talk about those things too. Nurse T, I want to give you an opportunity to share with us the things that you feel are important that the community really, really think about as we're thinking about kidneys.
I was just thinking about hypertension. I remember prior to starting my position in the community, I asked one of our nephrologists if it was one thing that I could concentrate on and focus on. He said, if you could just focus on hypertension, educate on the silent killer. And when we look at the statistics, and I was just put some data in the chart, we see the studies is saying us that 20% of young adults starting at 18 to 39 is hypertensive. And when you look at, so that's 1 in 5 young adults. And then you look at ages 40 to 59, 55 to 60% of us have hypertension. So really starting early in elementary and junior high and educating on hypertension so that they can at least try to put things in to manage it, because, or at least know their numbers. A lot of times it's because we don't know our numbers. I always tell people, if you're dating somebody, ask them for their number, not their phone number. You ask them, what is your blood pressure numbers? What is your cholesterol numbers? What is your A1C? Know your numbers. Know your numbers so that you can manage. Because the 3 things that we really worry about is unknown, undiagnosed, and unmanaged. And don't be scared. We have to stop being scared. We have to stop being afraid of the unknown. Just the other day, somebody was saying, well, if I'm sick, I don't want to know. Yes, you do. You do want to know, because we have technology, we have experts, we have people that care, that can help you before it's too late. So that's just
Nurse T. Nurse T said on this Valentine's Day, if you care about someone, you will get more than just their phone number. You will get their blood pressure and their cholesterol number too, and make sure they're taking care of themselves. So that is what love is. I appreciate you, Nurse T. All the love to all of you. Thank you so much for this wonderful expertise. Can we shout out our med students who led this off with helping us understand what kidneys look like and how they work and how they function? Shout out to our CHM LMU med students, to Dr. Esch for being such a wonderful leader of those med students. We appreciate you. I want to give us a few minutes because we have a little bit, or a few seconds rather, we have a little bit of an update on how we manage CEUs. So Blair is going to show us that for a second. All right, so there's been an update.
Yeah.
Blair, you can go ahead.
Okay, great. Yeah, so we made a small update. You can still receive credit for attending the webinar if you're a community health worker. The small update really is you have to attend it live. You can't watch it later on YouTube to receive the credit. So watching it live, and then at the end of the webinar, every webinar, you will be prompted to complete a survey. Once you complete that survey, I will receive that completed survey, and I will email you a certificate of completion that is more tailored to you with your name and the specific webinar mentioned on it. So you will be able to then submit that for your credit. And you can email me if you have any issues with that. And I can help troubleshoot anything. So yeah.
Fantastic. Super appreciate all of you. Have a wonderful Valentine's Day. Get people's numbers and make sure you take care of yourself and others. Bye.